Welcome everyone to the CELPIP Listening Part 5 video discussion analysis. I'm just here in the Listening Part 5 section of the CELPIP Library. And before we get started, I do want to remind you that Part 5 has more focus on CLB 7 or higher. What does that mean? Well, that means that if you need to get CLB 7 or higher, you need to concentrate on this part. You need to do more examples of part 5, and you need to try understand the types of questions, types of language. That's because doing well in this part can help you get 7 or higher. Now, if you need to get lower levels, 4, 5, or 6, it means that this part will be more difficult for you. So it will be more difficult language, more difficult questions, and it will be harder to get higher scores. But don't worry. If you don't do so well in part 5, that's okay, because CLB 4, 5, or 6, you need to concentrate more on part 1, 2, 3, and 4. Those sections will help you much more to get 5 or 6, okay? All right. So, again, higher levels, we need to concentrate on this part of the listening more. Okay. As well, we have this great listening part 5 tips and strategies video, okay? And that video will give you some more details about how you can improve your listening skills for part 5, and also some tips and strategies that you can use for answering the questions more effectively. So that video will be linked in the description box, okay? So I recommend watching that video. So then, now we are going to do a sample today called Patient Records. So let's get started. Okay, so I'm here in the front page of this sample, and you notice that it has 6 parts. This analysis video, some vocabulary building, some comprehension building, following dialogue, test practice sample 1, test practice 2, version 2 of that exam. So we're going to do version 1, okay? That's the one that we're going to do. Let's focus on that. Okay. So everyone, now before we get started, I do want to remind you that I'm going to be giving you a chance to do the listening for yourself, okay? So that means that I will give you a chance to do the questions as well. First, you're going to do the listening, okay? You're going to watch the video, and then we will go over to the questions, and you can answer the questions. And then after, we will analyze, okay? Now, before we get started, I do want to remind you that listening part 5, usually it's a workplace video. It's related to the workplace, okay? And we always have 3 speakers. It can be 2 men and a woman, or 2 women and 1 man. All right? So, very important. First, we need to understand what is the issue. That's very important. What is the issue that they are discussing? There's always some main issue they are discussing. And also, we need to understand what each person from all the 3, what is their role and what do they say about the issue? Okay? It's very important. What does each person think about the issue? Do they agree with each other? Do they disagree? And overall, what is their opinion? Okay? And also, we should also think of what they decide to do. In many cases, they decide to take some plan of action. Okay? So, or they conclude something in the meeting. So that's also important. Also, everyone, just some tips for listening. Let's make sure we listen to full sentences. Okay? Full sentences, not just words. Okay? This will help you gather ideas, not just words, because concentrating on words will only make you maybe select the wrong answer. Okay? We need ideas, not just words. And words can confuse the answers. All right. And then also, of course, it would be very important for you to take notes. I strongly recommend taking notes. All right. Especially for higher levels, you should take notes. Okay. Especially notes about each person and what they have to say. But if we take notes, let's make sure that we take notes, but we still concentrate on the listening. Because sometimes students take notes and they focus too much on notes and what they're writing, not on the listening. But it's very important to focus on the listening. So for lower levels, I recommend that you try to repeat as much information as you can. Repeat full sentences, not just words. Okay? And also, I think for higher levels, repeating the information as much as you can will also help you. All right. So then, like I said, let's get started over here. Let's get started with the video. Okay? And also, everyone, one more thing. They will tell you who each person is. So keep in mind who is which person. Okay? All right. Here we go with the video.
I would really like to know what's making it difficult to get proper patient records when we need them. I thought with our healthcare system being so up to date, we wouldn't have any of these simple issues.
I think part of the problem is the patients being irresponsible. I mean, they should have knowledge of what type of medication they're on, don't you think?
Well, yes and no. I mean, we have patients who are coming here, they're seniors, and they certainly don't necessarily have all the facilities that we would like to see. And we have patients here that need translators, and they really don't have a clue about medical information and records.
Good point. But as you know, everybody gets a discharge report once they come off their medications. So what's so hard about them putting it in a nice folder and keeping it organized?
Both of those are valid points, but what I'm talking about is our internal healthcare records. How is it possible for those to be outdated? I've had 2 patients this week who both reported visits and prescriptions which hadn't been recorded.
Well, if you're talking about the patient who was here this morning, you realize he's been at 3 different hospitals. I mean, he's obviously not going to have medical records that are tracking him to 3 hospitals, and we need to fix the portal somehow.
I agree. Or as you said, that some patients don't explain their issues or symptoms correctly or clearly, which sometimes makes it difficult to document. And those records are probably just write-offs.
I sure hope not. How is it possible to misreport anything which could be a matter of life or death? Not only does that endanger our patients, but it could open us up to liabilities, which I certainly don't want to be a part of.
Right, and I don't think any of us want to be accountable for that. I mean, I'm sure that our contracts clear us, but it's a matter of life or death. That's pretty scary.
So then, everyone, now we are going to move on to the questions. Okay. And like it says here, we have 4 minutes to answer 8 questions. So that's about 30 seconds per question. So you can read the questions and the answers, and I will be timing you over here per question. So then let's start with question number 1. Okay. Okay, now let's move on to question 2. Okay, now let's move on to question number 3. Now let's move on to question 4. Now let's move on to question 5. Now let's go on to question 6. Now let's go on to question number 7. Now let's go on to question number 8. Okay, then, everyone. So let's now analyze the answers. Let's see how you did, okay? So then, everyone, let's read question number 1. Where is this conversation taking place? At a university medical training facility, at a hospital in an urban area, at a quite remotely located retirement home, at a clinic inside of a private office. Okay. So I know that it's not a retirement home. There's an administrative assistant, there's a head nurse. Doctor sounds to me like some kind of hospital or clinic. I'm not sure about clinic or hospital. So also not university medical training facility, not a medical training. Didn't sound like training there. So hospital or clinic? Hmm. Now, I do remember I have here the script. Let's look at that. And I do remember, well, I do remember them saying it's some kind of hospital. Okay, I see over here. Nurse, if you're talking about the patient you had this morning, I'm sure it has to do with the fact that this is the third hospital he's visited in the last 3 weeks. So if I had to guess, I'd say that the issue stems from randomized patient visitation, which backdates the main healthcare portal. So it seems like this is some kind of hospital, okay? Maybe small or some kind of hospital. Doesn't seem like very large, okay? All right. So we can say the answer is hospital instead of clinic, okay? What about number 2? Why is the lead physician so upset? So the lead doctor or physician, why is he upset, not happy? Because patients have been providing false information, because the clinic isn't getting enough patients, because medical records haven't been kept in order, because the patients are not taking correct medication. So I don't think it's about not having enough patients. We already read that wasn't the main issue. And also, well, let's read here. I would really like to know what's making it difficult to get proper patient records when we need them. I thought with our healthcare system being so up to date, we wouldn't have any of these simple issues. Okay, so get proper patient records. I think part of the problem is patient irresponsibility. I mean, they should have knowledge of what type of medication they're on, don't you think? Yes and no. If we're dealing with older patients or new immigrant patients who come with translators, they have difficulties with keeping records of anything really. So I'm not surprised that some patients are completely clueless on their medical history. Doctor, again, both of these are valid points, but what I'm talking about is our internal healthcare records. How is it possible for those to be outdated? I've had 2 patients this week who both reported visits and prescriptions which hadn't been recorded. Okay. So about patient records, it sounds here. So not enough patients. Patients are not about patients taking. We don't know if they're taking the correct medication. And also not about the patients providing false information. He's talking about the medical records not being in order. That's what he mentioned there. Number 3, how could this impact them all in the long term? So how can they all be impacted by this situation in the long term? They could lose patient records, they could lose experienced staff, they could make small mistakes, they could all face serious consequences. Well, it's definitely not A, because it's not about them losing patient records. Okay? Also, well, let's see what it says here. Let's look again. I agree, or as you said, sometimes patients don't explain their symptoms or issues clearly, which sometimes makes it difficult to document, and those records are probably write-offs. I sure hope not. How is it possible to misreport anything which could be a matter of life or death? Not only does that endanger our patients, but it could open up possible health liabilities, which I certainly don't want to be a part of. I don't think any of us would be held accountable for such misreporting, and I'm sure our contracts clear us from that. But as you say, it could be the difference between life or death for someone, which is scary. So, death, I heard, liabilities, not small mistakes, and not about losing experienced staff. So serious consequences, serious problems in the long term, okay? What does the administrative assistant attribute the problem to? So what did the assistant say the problem was? Having difficult folders to keep the records? Having too many patients and not being able to focus? Having not enough training to understand their needs? Okay, having patients who don't get involved in their care. I didn't hear about training. So, not enough training. She didn't mention that. Also, she didn't mention patients who are not able to focus. Well, maybe B, but actually, definitely not A. She didn't talk about folders. Okay? So, not A. Having too many patients and not being able to focus, having patients who don't get involved in their care. I think it's D because she mentioned about patient irresponsibility. Let's make sure here. I think part of the problem is patient irresponsibility. I mean, they should have knowledge of what type of medication they're on. So they don't get involved or they don't know about their records. That means irresponsibility there. So they don't get involved. They are irresponsible. Not too many patients. Okay. Number 5. What does the head nurse suggest about the level of patient English ability? The higher level patients keep better track of their records. The lower level patients are not treated fairly. The level of language affects the hospitals they visit. The level of language affects the time to get medication. Well, not D. It's not about the time to get medication. Okay. The level of language affects the hospitals they visit, not the hospitals they visit. No. And also not B. Lower level, they're not, it's not about treating them fairly or not. So it has to be the higher level patients keep better track of their records. So let's read that part again. Yes and no. If we're dealing with the older patients or new immigrant patients who come with translators, they have difficulties with keeping records of anything. So I'm not surprised that some patients are completely clueless on their medical history. So this means that people who are newcomers who come with translators, they have difficulties keeping records. But higher level ones keep better records, okay? Number 6, what does the lead physician seem to agree with? So what does he agree with? The nurses are not doing their absolute best. The concerns they have shared with him are valid. Patients are not at all responsible for their health. The staff is not ultimately responsible for the patients. Well, not D, because he mentions that they are or they could be responsible. Okay? Also, they didn't talk about the nurses doing their absolute best. So it's not A. They didn't talk about that. He actually could be suggesting they're not doing their best. The concerns they have shared with him are valid. Patients are not at all responsible for their health. I think he didn't mention C, but I think he mentioned B. Both of those are valid points. But what I'm talking about is our internal health records. Okay, so both of those shared by the nurse and the assistant, they are valid points. So that's why it's that one. Again, he didn't talk about the patients not being responsible, okay? Number 7, what could make the problems become even greater? Patients often have difficulty describing their symptoms. The doctor is often too busy to assess the records. The nurses are not fully qualified to assess symptoms. Patients often conceal the truth about their medication. Well, it's not the doctor is too busy to assess the records. He didn't mention being busy. Also, not the nurses are not qualified. Not about not qualified. No, I do remember something about difficulty describing symptoms, but also conceal. That means hiding or not telling the truth. I think it's more A, but let's have a look. Assistant, I agree. Or as you said, sometimes patients don't explain their symptoms or issues clearly, which sometimes makes it difficult to document, and those records are probably write-offs. So patients do not report their symptoms clearly. So there we go. Patients often have difficulty describing their symptoms, not conceal the truth or hide the truth. So A. And number 8, what is the most vital or most important factor of the issue to the speakers? How it relates to patient mortality or death, how it impacts patient morale, or how positive they think, how it lowers office morale, how mortality relates to the office. So the answer here, well, it's not about office morale, so I don't see office morale, and it's also not about morale in general. Morale means how you think, positively or negatively, your attitude, how you feel about it. Positive morale, negative morale. So not about patient morale. So it's also not about mortality or death to the office, it's about patient mortality. Basically, they mentioned if it's a matter of life or death, but as you say, it could be the difference between life or death for someone, which is scary. So it means if they have the wrong if they misreport information, or if something goes wrong with those patient records, it could be something that could end up with the patient's death. Okay, very interesting. Well, hospital issues are always a concern. So, how did you do? Let's have a look. So, did you get 8 from 8? If you didn't get 8 from 8, don't worry. That's why you're here practicing, okay? And to practice, everyone, we want to make sure that we review the answers. It's very important to review the answers and understand why the answer is the answer, okay? We need to understand why is the answer the answer. But not only that, at the same time, we need to understand why some of the answers are not the answers, okay? It's very important. That will really help you improve your comprehensive skills. Also, everyone, it'd be a great idea for you to do version 2 of this sample. And for that, I'm going to be leaving a link in the description box to our sample question. This one right here. And you can do test practice 2, okay? Which is be a timed example, all right? So you have here the same video, okay? After the video, you answer the questions, all right? And it's version 2, so different answers, of course. We are having different answers, different questions, and different answers, okay? So that would be really great practice for you. Also, you will find in that link vocabulary building. Very good practice. Vocabulary that relates to this listening, very good practice. Very good exercise here. Put in one of these words to complete the sentence. This will really help you build your vocabulary. Okay. Also, comprehension building. You listen to this one here.
I would really like to know what's making it difficult to get proper patient records when we need them. I would really like.
And then you read the possible answer choices. Is A the same meaning, or B the same meaning, or both A and B have the same meaning, or neither A nor B? Very good practice for comprehension, everyone. Strongly recommend that one. Okay. And also, following dialogue. Very good example as well. You listen and you follow along, and you put in the word that you hear while you read. It's a great exercise. It will really help your listening skills. Okay, everyone? Also, let's not forget about the CELPIP Library, everyone. The CELPIP Library, again, if you need a higher level, it has over 50 examples of listening part 5. Okay? All right? And that will really help you build your listening skills for this part. Okay? And I will leave a link in the description box to the CELPIP library, or it will be there in that link. And because you've watched the video all the way to the end, with discount code CELPIP79, you can get a 3-month subscription for $10.99 Canadian, everyone. That's great for over 50 to 60 exams. Excellent practice, and I strongly recommend it. Don't forget, everyone, practice makes perfect.